Hello, Dr. John Shieh here. I'm excited to share with you the V-Shot, or vaginal injections of PRP. Now, this treatment is used, of course, for women, and these are injections of PRP, which is platelet-rich plasma, and that's derived from your own blood. And this is to help with different things, everything from incontinence that women might experience, especially after having childbirth, for vaginal dryness or an irritation, especially after menopause. This dryness irritation can also cause painful intercourse, and so we can help with that. We can help with decreased libido, try to help increase it, as well as orgasmic potential, or improving the orgasms, because due to loss of nerve sensation in the vaginal area, and we can restore that utilizing the PRP. Now, the PRP, again, was platelet-rich plasma. PRP is derived from your blood. We do draw 50 milliliters of blood, which is what you would typically have removed when you're getting a set of blood tests done. And then we take that blood and it's centrifuged, and that's a spinning process that separates the red blood cells, the platelets, and the plasma, and then we concentrate it with just the platelets and the plasma to a 5-time concentration. And that's really important, because in the studies, a 5-time concentration of platelets is what's shown to be the most effective. Now, there are systems out there for a PRP, these PRP kits that doctors often use, and it only gives maybe 1.6 times or 2-time concentration, a very low concentration. Some may be better than others, so that they're not all the same. But rest assured, at Rejuview, we use our own process that assures us of the right type of concentration that we need, and also in the volume, the amount that we need. Now, PRP, these platelets, we say, well, what's the purpose of these platelets? Well, the platelets themselves, we do know typically that they help with when you're bleeding, and the platelets will help create a clot, stop the bleeding, a scab forms, and eventually the tissue heals. But what we sometimes don't realize is that once these platelets are activated, they actually release dozens of growth factors. And these growth factors are for repairing collagen and tissue and dermis, your skin, or muscles, even blood vessels and nerves, or even bone tissue. So the platelets serve a lot of functions. It also releases a signal, a chemical attractant that activates our own stem cells that are in the area, and the stem cells become active and they migrate, they move towards where these platelets have been placed, or where the platelets have localized, and they work together with the growth factors to help repair and heal that tissue in that area. Anything in that area will be improved by these stem cells. So the platelets are very powerful when we harness their potential. Now, how do we administer this? Well, first we apply a topical anesthetic in the vaginal area, labia majora, labia minora, clitoral area, and even near the urethral opening. And so we apply topical anesthetic, let it set in so that the area is numbed as best that we can, and it's quite effective. Some people, that's all they need. But after that, we actually utilize injections of lidocaine. So with a tiny needle, we apply lidocaine to all the areas that we're going to treat, and that further anesthetizes and numbs the area to make it as comfortable as possible. Once that's set, then we apply the PRP, and there are injections all around the area where the nerve function is critical for sensation, on the outside as well as internally, to help in the vaginal area, the internal tissues, as well as around the urethra, even the G-spot area where the nerve endings are. So the PRP is injected. There's usually no side effects from it. There's always a chance of bruising when you have a needle involved, but it doesn't happen very often. Some soreness can occur for the next few days. It's possible, but the results start improving within days to weeks, and then it continues to improve over the next few months. And the V-Shot can be repeated within 4 to 6 weeks, or as needed, depending on each person. Now, often we do combine the V-Shot with our other vaginal rejuvenation treatment, which is called the Thermiva. And the Thermiva briefly uses radiofrequency electrical energy in a very non-invasive way, non-painful. And what this electrical energy does is it actually causes tissue tightening. So collagen is in the vaginal area is tightened. It does also stimulate the nerves to regenerate and become more sensitive. It does improve blood flow, improves the moisture vaginally, and basically it enhances each other. It potentiates. Together, synergistically, they have a greater effect than each one separately. So the opportunity to do the V-Shot is great, combined with the Thermiva is awesome. So give us a call at Rejuvu. We can set up a consultation with myself or our aesthetic consultant, and we can go over the options with you and what might be best for you. So look forward to seeing you, and thank you for letting me share this with you. Take care.